Everybody in the entire world is suffering from COVID. Whether you had COVID, you knew someone who had COVID, you got the shot, you didn't get the shot, now we all have to deal with long COVID. So Melanie, can you tell them how many times you've had COVID and what's going on with you?
Sure. This year was my third time. I'm having shortness of breath, difficulty taking like a full deep breath, brain fog, like forgetting things that I usually don't, and it's frustrating me.
Got it. Okay. So there's a number of things. There's not a specific protocol per se, but there's a lot of things that you should hit if you have any of the brain fog, any of the difficulty breathing. Okay, so here's the first one. You want to get glutathione, trisomal glutathione. Those are the strongest antioxidants for the human body, and they are amazing for long COVID. If you can get the trisomal glutathione by Apex, it can help you massively. I have my patients take it every hour, 3 to 4 to 5 times a day. If you've lost your sense of smell, flip over for me, Mel. It will help you get your sense of smell back. If you get trisomal glutathione, you can get it in packets that look like this. You can literally go to my Apex store if you want to. You can go to your health food store. This is my favorite form. It is disgusting. I will tell you that right now. It does not taste good. And as you get your sense of smell back, it tastes even worse because half of taste is also what you smell. You can get it in pill form. It is not as effective. This is the one that I use in my office, but however you get it, you get it. You can also get glutathione recycler, which helps your own body make it. Certain people cannot take glutathione because there's sulfur in it, and some people have a sulfur allergy. So glutathione is one. Next one, N-acetylcysteine, also known as NAC, is very good at thinning out mucus. It is also very good for people who have had long COVID. People who have ulcers, however, cannot take NAC because it thins out mucus. So if you have a sinus issue, if you have long COVID, great for you. If, however, you have a stomach ulcer, not great for you because it will thin out the mucosal lining in the stomach. Next thing, if you have it in your face where you just feel like stuffy all the time, you can take quercetin with bromelain. Bromelain comes from a pineapple. Quercetin with bromelain will decrease the inflammation and swelling within the sinus cavities. So those are 3 things that you can take. You should also stay away from dairy, and you should stay away from alcohol and sugar. Why? Because those are massively inflammatory and your body is already inflamed. So you want to eat as healthy and clean as possible. So those are what we call the first tier of care. They're basic things that you can do. Now, if you notice what I'm doing right now with Melanie, I'm literally getting my bony little fingers between all of her intercostals and I'm stretching them out. Why? Because the thoracic cage is what houses the lungs. So if the thoracic cage can't go like this and open and expand, neither can the lungs. The lungs are not like an umbrella. They don't go up and out. So if you're breathing and your shoulders go up, that's not great. You want to come out when you breathe. So when you watch me breathe, my chest gets wider. It doesn't go up. People who have long COVID, you can do the Wim Hof breathing technique. If you do his power breathing, that is a high intensity interval workout for the intercostal muscles. You have to open those back up. You can have someone do exactly what I'm doing. You can have someone do active release technique. You can go to a massage therapist who opens this up. But you have to open up all the muscles of inspiration, all the muscles of the thoracic cavity. In women, a lot of times they end up like this. Well, that means that your lung capacity is also diminished because you're not upright. So you can't get that full expansive breath in and out. So Mel, when I'm doing this, does it hurt? Does it feel good? Does it feel like a stretch? What does it feel like to you?
It definitely is stretching, but it feels good to me because I think anything's better than tightness.
Anything's better than the tightness. Now, some people will say that they feel it on their breath in. If you can't take a full breath in, it could be that your ribs that should be going like this, they're not expanding properly. So the rib heads can actually get stuck in a posterior position or an inferior position. Chiropractor can actually adjust them so that they can move up. Sometimes people will feel it on expiration, which means the rib heads are stuck up and they need to be brought down. So it is a combination of healers, of treatments that fixes long COVID. And as long as you can get some combination in there, you'll do good. This is the list of as many things as I can think of so that you can choose what is right for you. If you have somebody working on you, they have to open up pec major. They have to open up pec minor. They have to open up the intercostals, serratus posterior inferior. Turn on your side facing that way. They have to open up latissimus dorsi because the lat muscles attach to the side of the ribs. If you're like, hey, I don't have somebody who can open this stuff up for me, no problem. You can open it up yourself. What you can do, interlace your fingers, go up and over your head. Take a deep breath in. Breathe out. Take a deep breath in. Reach higher. Breathe out. Take a deep breath in. Reach higher. Breathe out. And stretch to the sides. All of that will open you up. If you notice that when you interlace your fingers, you can only go like this, that's quite telling too, because that means these muscles are so tight that you can't pull yourself back. So you don't want to be here. You want to eventually get here and to the point where you can actually go backwards. You can foam roll. You can have someone stretch you. You can have acupuncture, physical therapy, massage therapy. All of these things can open you up, but the point is the thoracic cavity must be reopened. Another thing that you can do is you can get an inspirometer where you breathe and there's a little ball and it goes up and down based off of how much you can breathe. So you can measure yourself. Another thing you can do, you can get a tape measure and put it around your waist. And what you do is you breathe out all the way and then you breathe in. And the widest it gets tells you how much the thoracic cage is opening. Measure in the same place each time. Usually right here is a good place to measure. And what you want to do is work on your breathing and then re-measure. How much wider can you make it through stretching? Yoga is phenomenal for you. But everybody knows someone who's had long COVID. Flip the other way for me. So in addition to changing what you eat, having someone open this up, taking the right nutraceuticals for long COVID. If you can, try to breathe through your nose. Every time you breathe through your nose, you increase endothelial nitric oxide synthase, also known as ENOS. There are other forms of NOS, nitric oxide synthase. Some of them are inflammatory, some of them are anti-inflammatory. Endothelial nitric oxide synthase is massively protective for all the blood vessels. Blood vessels are very, very important for oxygen flow. Blood vessels go like this. They constrict, they dilate, they constrict, they dilate. And in doing so, that exercises them because they're smooth muscle. So to exercise smooth muscle, the Wim Hof breathing is very good. Any kind of deep breathing will be very good. But breathing through your nose in particular is good because it gives sensory input to the brain as well. Listen, if you can't breathe through your nose, you've never been able to, no sweat, then just make sure you're taking deep breaths in from your mouth. But the point is, make sure you're not just taking shallow little breaths. Make sure that you're opening up that thoracic cage as much as you possibly can. You feeling this pretty good?
Mm-hmm.
Okay, so now I want you to do a stretch for me. What I want you to do, Melanie, is you're gonna come to this wall. And what you're gonna do, you're gonna put one leg right here. And you're gonna put your hand palm down, okay? And what you're gonna do is you're gonna take a deep breath in. And bend. And turn your head.
Okay.
And then you're gonna come back. Ideally, you wanna turn your head more than mine. My neck turn is not that great. I've been in a few car accidents. And come back. But that'll open up the thoracic cage too, because thoracic rotation is the first form of rotation that you lose when the spine is tightening up. And it's the one that you most need to gain back if you're gonna get rid of long COVID. These are just things that I have learned and observed from treating all of my patients. So far, all of my patients have gotten a lot better from long COVID. So this arm goes here, and you go there. Do you feel a nice stretch on that?
Yeah.
Good. Now take a deep breath in, and breathe out, and come back. Not everyone will be able to go that far. You might only be able to go a little bit. Go to comfort. Don't strain anything. And it's easiest to strain things first thing in the morning because that's when you're the most hydrated. So do it one more time for me. Good. So that's really good. And does that feel like it opens you up a little bit?
Mm-hmm.
Okay, perfect. Come sit here on the table for me. We already did a bunch of these things, but if you know someone who's really good at active release technique, serratus posterior inferior is a muscle that's also very good for breathing that a lot of people forget about. So cross your arms, okay? Twist to your right, bend to your left, A little more. Deep breath in, hold it, reach for the corner of the room. You feel a nice stretch on that too?
Mm-hmm.
Good, and let go of that breath. So we already did that on each side. We did it 3 times to the right, 3 times to the left. Another thing you can do, lie on your back, you can do what's known as the YTL exercises. Ideally, you're gonna do this on a foam roller, where you have the foam roller underneath your head going this way so that your tailbone is supported. But what you do, you take your arms, this is T, you're like a cactus. You can also just lie on a foam roller in this position and breathe. And that should open this up through here. Now, when you poke right here or right here, is that tender on you?
Mm-hmm.
Okay, so those are trigger points for pec. You want to loosen those up. So this is T, this is W, and now go straight up, Y. Y, when you do the Y, try to engage your lower trap for me and pull down. There you go. So it's W, T, Y. Doing something that simple every day to open up the thoracic cage is going to be huge. Now here's another one that people don't think about. If you're leaning forward, especially on your cell phone or at a computer like this, which most of us are guilty of doing, think about what that does. You're crunching down that thoracic cage again. You don't want that crunched. You need this open. You need to be able to pull your head back without it feeling like a bowling ball, without feeling like you're being pulled forward. So that's why you have to loosen up that anterior chain. So another thing that you can do is you can have somebody stretch out your neck muscles. Do you feel stretch on that, Mel?
Yes.
You feel it a lot, right? So these are the scalenes. There are specific protocols through active release technique, physical therapy to loosen up scalenes. It's very important that you stand up straight, that you have your chest out, because if you don't fix the biomechanics, you're not going to be able to get that lung capacity back as much as you should. Obviously, you should also see a pulmonologist. Make sure that you hit all the doctors who are responsible. My job is to give you references and to fill in the blanks so that you have an idea of what to do. But there's so much you can do on your own. A lot of it's going to start with you being mindful of how you walk, how you breathe, how you stand, what you're putting in your mouth. So for example, let's say you're not having dairy and you're not having sugar, but you're horking down your food and you're not chewing it. That alone means that you're not absorbing what you need to, because food not only has to be eaten, it has to be absorbed. The nutrients have to be absorbed in stomach, small intestine, large intestine. Then it has to get to the receptor site. And if the pieces are too big when you get to the stomach, the dendrite, which is part of the immune system, samples it and goes, I don't know what that is, and it could end up attacking it. So everything makes a difference. Little things that you think are not connected are massively connected, especially when it comes to long COVID. So if you do nothing else besides try to take deep breaths in, you can do box breathing. You can breathe in for a count. Go ahead, do this for me. Breathe in for a count of 4. Breathe out for a count of 8. Now try doing all of that only through your nose. Go ahead and sit up for me. So many things are overlooked. You're gonna go that way. Cross your arms again. Even intercostals and obliques, they make a huge difference for thoracic cage. So even opening these guys up, you feel stretch on that?
Yeah.
Anything that is tight is gonna affect everything else in the body. So don't think that having tight ankles, having a tight neck, aren't gonna impact your ability to take a deep breath, because it works on fascia too. Fascia is the connective tissue that attaches all the different muscles. And so tightness, even the ankles, could tighten up your neck. Possibilities are endless. You can get your long COVID better. Hopefully you found at least 5 things that will help you.